hope is that this presentation is both meaningful and helpful with sort of specific takeaway elements you can employ in your day-to-day, both at home and at work. I think there's a lot of overlap for us right now. And for many of us, you know, work and home is the exact same place, myself included. So I've worked in the front lines in many roles with people at risk, dating back to my time in Vancouver's downtown east side, where I did street outreach for 5 years. Before moving into a clinical role after completing my MSW. And then since moving to Toronto, I was managing 4 different teams there with varying levels of needs. And programming was around addictions, mental health, housing, social assistance, working with seniors, case management. So I've got a pretty well-rounded sort of insight into a lot of these things. So I'm hopeful that a lot of what I share today is going to be helpful for everybody who's participating, and any feedback that I can get on what is helpful and not helpful through the surveys is going to be great as well. So please feel free to ask any questions that come up for you. So without further ado, I really like this quotation. I was listening to Brene Brown's new podcast, and this quotation came up for me. Sorry, I've got notes in front of me here, so I'm going to be looking down a lot so I don't miss anything. And so the quotation, if the definition of vulnerability is uncertainty, risk, and emotional exposure, then being anew at something is the epitome of vulnerability. And so in her podcast, you know, she talks about FFTs, or what she calls fucking first times, and the challenge of how hard that can be to be doing something new for the first time, and how it is also the lifeblood of what keeps us alive and growing or moving forward. So we are in an extreme FFT right now, or fucking first time, pardon my language, and we all need to be able to be kind to ourselves and to each other as we're navigating this, because it really is uncharted territory, and we don't really know what it's going to mean or when things are going to lift. So just a reminder about that, and you know, Brene Brown is a great person to share that with us. The agenda for today, some of the things I'm going to touch on and briefly cover. So some of the common rumors that might possibly be held by staff or public that we're seeing. What are maybe some of your staff might be experiencing? Messaging for the general public, but I think also for our staff members, some of the activities that we can share with adults. As a team leader or manager, what are some of those messages that we can give to our frontline staff? And at the very end, I've got a couple of images. One is a mental health continuum model, and it shows, you know, from sort of wellness to illness. And then the second piece is what can we do as managers or support people when we're in that sort of wellness to illness. And then some references and then the Q&A at the end. So I'm really looking forward to this. Okay. So some of the common rumors, there's a lot of disinformation circulating right now, and these are just some of the common myths or misconceptions that I'm hearing from folks, that they're hearing from other people and throughout their lives as well. Some of these are going to shift and change over time as well. You know, I think back to a couple of weeks ago when we heard from the government saying, you know, don't wear face masks, you don't need them, and now we're hearing sort of an opposite messaging from them. So knowing that it's important to keep updated on some of these things, but also that we need to find those trusted sources of information. And where can we find those? Who do we trust? It's important to remember that people are really hungry for information right now, and they're just wanting to know what they can do to keep themselves, their clients, and their loved ones safe. So that consumption of information is really done in order to do just that. It's not in a way to raise fear or panic, but we're all just trying to find what those best practices are along the way, and just really being aware of them so that we can be informed. So, you know, I just put some of these up here that I found online, but, you know, there are also different things that are coming up. So I put that any others because you're going to hear this from your staff. You're going to hear this from those people. And so rather than dismiss it, maybe asking questions and being curious about it. Where did you hear that? And, you know, what's your concern about that if that is something that's coming up for you, so that we can support people and them not feel stupid or shy from bringing up those things, because we really want to call people in versus calling them out and bring them closer so that they can feel that support. So what are some of the things that staff are experiencing? I think it's really important to identify and speak to what staff may be experiencing as a result of this. Many of us right now are lucky enough to be able to work remotely, support our agencies, support our clients in that way, but there are a lot of other peoples who don't have that opportunity right now. So, as we look at this, this is certainly not an exhaustive list at all, and this was taken from Canada.ca website, but truly it just starts to highlight some of the worries that your staff and colleagues may be experiencing right now. And just take a moment to think if any of these things are something that you are struggling with or someone may be struggling with as well. Because, as we go through this, again, it's all sort of a lot of fear is coming up with people. So, fear of being separated, the traumatization of experiencing past epidemics, that feeling of helplessness or loneliness, and fear of becoming ill, fear of losing our ability to work. Those things are all really challenging for us right now, and they're going to affect our mental health and our ability to really come to our job with as much vigor and awareness as possible. I'm going to really try not to just read these slides and just give the information. I'm trying to watch the time as well so we can have a really fulsome Q&A period. So I'm trying to kind of manage two different screens here. So I appreciate everybody's patience as well. So messaging for the general public. So I found this through the World Health Organization, and it's messaging that they've curated for the general public. However, I really think this is also information that's relevant, to share with your staff and coworkers at the same time. Again, really trying to normalize this, that it is a first time for all of us, and we're trying the best we can. And there are sometimes when we're just not going to know exactly what to do. As you kind of go through some of these items, just look at them and identify maybe what you've done for yourself, what you think could be helpful to share with others that may help mitigate some of their distress and what they might be experiencing right now. Many of us have done safety planning, with regard to violence and whatnot, and these items really parallel that experience as I kind of went through this list, having worked in domestic violence, to really look at how can I be prepared, as I look at have a plan of where to go to seek help for physical, mental health, psychosocial needs if required. Really being able to be in front of that curve for ourselves and saying, okay, what is it that if something goes wrong, where can I go? And who are those people that I trust to get that support from, but also that information from? Some of the activities that can support adults' well-being during home isolation and quarantine. I currently have a client that is now living and working at a hospital in New York, and there I am receiving an onslaught of messages from loved ones that are concerned about their well-being and urging them to return to Toronto immediately. And this person really spoke to the hospital having been preparing since January, that the CEO of the hospital is giving daily video messages about the state of things. They created an app for all the employees to connect and get updated information and support. So she's feeling very supported and very strongly that they're getting the best information to make choices for themselves. And they've decided to stay in New York right now. So, they have looked at where can I reduce the time spent looking at fearful images, seeking information from reliable sources, as we see on here. And they've also put into play reducing the time that they're looking at information. So they're kind of checking in with that in the morning with their CEO with that video message, getting that information they need for their day, and then moving forward. And then the other great example of what this person did that I think that was really amazing was that they were able to set boundaries with people in their life and really understand that, hey, I understand you're getting this information. I understand you're concerned for me, and that means a lot to me. And I'm choosing to make this choice based on the information that I am receiving. And I feel that this is the right choice for me. So it was a powerful moment for them to politely request that their loved ones accepted their choice and to not put their own fears and worries onto them as they were watching the news about Trump or whatever's going on in the States, but to really just, again, have the proper information and to say, I'm going to do what's best for me. So a lot of these things that we're looking at on this screen here, the activities to support adults' well-being, again, these are things that we can do for ourselves, but also that we might be able to share with some of our clients along the way also. When we get to the reference section of this presentation, you will see that there's the Canada.ca website is there, as well as Shared Health MB, which is from Manitoba. And a lot of this information, rather than invent the wheel, I was able to find a lot of this stuff in a couple of those places. So I took what pieces here that would make sense to be able to be consumable on the slide without inundating everybody with a lot of information on the slides. So those are going to be great resources, and we'll be able to share the notes as well after, as Sherry mentioned. Messaging for the frontline staff. So this is from that sharedhealthmb.ca. And, you know, normalizing the distress that we're all facing can be immensely validating and so impactful. We all need to remind ourselves that we have to put ourselves first in some of these situations. And so I always think back to the analogy of the oxygen mask on the airplane. So I can either, the mask comes down and I can take a deep breath and try to help everybody else and suffocate and be no help to anybody. Or I can say, hey, you need to take a deep breath. I'm going to get myself situated so that I can be supportive to others, get my mask on, and then I can help out whoever is within reach of me. So to really just understand, what can I do that's realistic, and what can I do that's actually going to be helpful without putting myself into further harm's way. So really understanding as well that we are collectively grieving and we are experiencing loss like never before in our lifetimes. And we need to really understand that and accept that rather than sort of refuse or push back against it. That this is something that we are losing our way of life, that we're not likely going to be going back to a world or life that is the way that we knew it. So there is going to be change. And to borrow from the DBT model of that radical acceptance, that this is the new norm in some ways, and there's going to be new things that are coming up, and there's going to be things that we haven't foreseen coming up over the next several weeks to months. So really just understanding that and finding ways to tolerate that distress that we're going through, because that chronic stress, as you can see in the last point here, is going to affect your mental well-being, your work, affect you even after the situation improves. So we're going to be carrying a lot of this as we move forward. I've read some people talking about potential post-traumatic stress disorder coming up for, and he specifically didn't say disorder, but as an order, for a lot of us that we're going to be coming out of this, because again, it's uncharted territory, and the grieving process and the trauma that we're experiencing of that loss is going to be significant. So it's going to be something that's going to be really, I don't want to overuse the word unprecedented, but it is going to be something that none of us have really seen. So being able to understand that and get in front of it. As we go through this too, you know, identifying where are you feeling supported, or where is the root of your distress, and how can you work through that, and what do you need to alleviate it? Where are your resources? Who can you reach out to? You do not need to experience this alone or in isolation. There are those resources out there. And if you're feeling that as a staff member or as a manager, you know, reaching out to colleagues, it's so great to see, you know, if I just click up here for a minute, how many people, we've got 70 people here. So that's 70 people who are all looking for some more of this information. And we don't have to do it all on our own, much like me borrowing a lot of this information that for our slides today. We don't need to reinvent the wheel. So reach out to those social networks, reach out to those professional networks. The CDBC is a great network as well. And just say, hey, this is where we're looking for information. Where can we find it? Or do you know where some of this information may be? And or what are you guys doing that you're finding helpful with your own agency and with your own staff as you're going through this as well? Next, so this is that mental health continuum model. So this is the first of two graphics. So this graphic, oops, sorry, my own notes are here. This first graphic really illustrates sort of like the healthy to illness or wellness to illness. And it really looks at what we may be experiencing sort of at each phase of your own mental health and some of the symptoms that may be rising up within ourselves or within others. So it's so important to remember that actions are born out of feelings and emotions, and those actions are not necessarily how we define ourselves or how we should be looking to define others, but really rather to look more deeply to understand what is driving that behavior. And I think right now a lot of that behavior is being driven out of fear and anxiousness. So I remember working in the role at Calgary Counseling Center, and we would often talk about how do we just validate and understand people. But when we were working in domestic violence, we would say, this isn't an abuser. We would say this is a person who has chosen to use violence or has chosen to use abusive behaviors in their relationship. And I remember in that role, when I would work with male victims that were coming in, male perpetrators, they would come and say, hey, well, this happened, and I was dealing with all this information coming at me, and I just snapped, or I just lost it. And the really difficult, challenging part was, how can I validate the emotion of what someone is experiencing without necessarily validating the actions or behaviors they took that might have been unhelpful / unhealthy / violent. And so as we're working with our staff and working with people, including our clients, understanding that those behaviors are a response to the fear that they're feeling, they're a response to the anxiousness that they're feeling, and they're likely not how those people would choose to behave in other circumstances. So how can we validate the emotion without necessarily validating the behavior if it's an unhealthy or unhelpful behavior? And that validation can be so key right now because we are all so isolated in our work, in our personal lives, and other people who aren't isolated but are maybe in environments that aren't great for their personal mental health as well. So with clients that I'm working with and seeing right now, I've got some that are completely isolated and saying, I just want someone around. I just want to find somebody to spend some time with. But I've also got people saying, I'm stuck right now with my partner and I love them to death, but man, I would just love to have some alone time, or I'd just love to just be able to go out with my friends. So we've got this real push-pull, and everybody's got different needs. And to be able to understand what those needs are from each person and to respond to them as best as we can. So as we go through this chart here and being able to look at, okay, where is that healthy place, and what's going on how can I identify sort of when my staff or my coworkers are maybe in that healthy place, and then just watching for those. I think it's also helpful to watch along this for yourself. So, if people are able to take this model and look at it, maybe have it on your desk or something, and just to check in with yourself each day and say, what am I noticing? What's going on today versus yesterday versus last week? Or what am I noticing in some of my coworkers, and how do I talk to them about that? I mentioned earlier this idea of calling in versus calling out. And I first heard about it from a student at Mount Royal when I was teaching there. And he said, I'd love for our class to call in versus call out. And I said, I'm not sure. Can you explain that to me? And what he talked about was, when we call someone out, we're calling them out on behavior that we don't agree with. And the calling out is the finger point. So we're isolating that person, we're putting them to the side, and we're not really inviting them in to have a meaningful conversation. However, when we're calling somebody in, we might see something that we're doing that we don't agree with, or is unhelpful, or goes against sort of policy or whatnot, but we're approaching it from a very curious place, where we're inviting that person in to say, hey, I noticed that you use that language, or I noticed you acted in that way, and I'm just curious what's going on, or what's behind that, or what was the reason for that? So it's the way that I really look at it is the calling out is the finger point, and the calling in is the hug. So I'm bringing you closer, I'm letting you know it's safe, and let's talk about these things, as opposed to saying, hey, you shouldn't be so angry, or you shouldn't have that aggressiveness, or that anxiety isn't helpful, so keep it to yourself. Rather than saying, hey, I've noticed your anxiety is heightened recently. Where's that coming from for you? I'd love to understand it so I can support you. And to just validate that, yeah, wow, I've been feeling anxious as well, or I can understand why you might feel that anxiety. So how can we work through that? What would be most helpful for you? And then as managers, but I think this is for everybody when we look at this next slide, is we've got that sort of healthy to ill and that continuum. So what can we do? So when you see over here on the healthy side, when things are going good, we can lead by example. We can get to know our employees, foster a healthy climate, identify and resolve problems early. So we're in that place where we're really able to be generous with our time and energy, and really able to support people as we're going through it. And as we kind of shift along, we can watch for some of those shifts in behavior, and try to adjust the workload as required, understand what the resources are and how to access them, and also reducing barriers to seeking help. So if we look at each one of these stages and how to support our mental health, these are only suggestions and may not exactly mirror your own resources or what your agency can do, but to really think about what's underlying each bullet and where you can align with that resource that you might have access to. So it may be worthwhile exercise for some of the managers in the group or some of the frontline staff in the group to say, okay, if I'm noticing these behavior changes in other people, what might I be able to do to support that person? What might be the resource that I can provide to them? Or if I'm looking over sort of the illness side, respect medical employment limitations. And so understanding that, there might be people that are working as nurses or doctors or LPNs or whatnot, and that they might have certain limitations on what they can or can't do, how they can interact with us or not interact with us. But also we can be generous with that and understand that and say, hey, I know that you are having to socially isolate because you work as a healthcare worker. Here's some resources that I know that might be helpful to work through some of those things. So to really go through this from a critical lens of, if I'm noticing this, what can I do? If I'm noticing this in myself, what will I do? Again, that sort of safety planning, get in front of these things and being as proactive as we can, because these things are going to start to come up for each and all of us. And then I'm just going to leave this up for a moment so you can just see what the references are and where I took them from. So these can be shared out certainly as well. I was really careful to want to not go too in depth into the slides because I want to be able to share this presentation. I'm going to be doing it again next week for a different group. And after that, I'm going to finalize the PowerPoint to be able to send it off so everybody will have access to all these slides. But a lot of the information I shared with you today was taken from these areas. So, and the Brene Brown podcast, I've only listened to the first episode, but I encourage everybody to plug into it. I've heard nothing but good things. My clients are sending it to me. Everybody is just raving about it. And she really brings a nice levity to her presentation style and her information. And then just some stuff on how to find me and now